My drinking was out of control. It was totally out of control. I would drink and have unprotected sex with people that I didn't know. I used alcohol when I was pregnant with my 10-month-old daughter, but she's now 10 months old. Her name is Kennedy. And as a result of my drinking, she has some developmental delays. As a result of that, my daughter's not with me.
Project Choices is a nationally based, evidence-based initiative that looks to prevent alcohol-exposed pregnancies. This initiative was developed by the Centers for Disease Control to work with women around two behaviors: the risky alcohol use as well as the ineffective contraception use.
In the mid-1990s, Starhill joined with the Brooklyn Treatment Court in working specifically with women who had experienced trauma. There was a significant need for more services. That need led us to our partnership with Project Choices.
In Project Choices, women have the opportunity to choose for healthy behavior, as well as our female residents learn how to prevent and avoid alcohol-exposed pregnancy.
One of the most important areas that I think many young ladies particularly are not aware of are fetal alcohol spectrum disorders.
When a child is born with fetal alcohol spectrum disorder, they have lifelong problems.
The more educated our patients are, the less likely this is to happen. My name is Ms. Brown. I'm the Director of Clinical Services with Damien Family Care Centers. Okay. My understanding is that you are a new participant to Project Choices. And
Project Choices is broken down into 4 sections. In the first session, we educate the women as to what is fetal alcohol spectrum disorder, and we start them on journaling. We have them write down on paper how much alcohol they consume, how many times they had sexual intercourse, and whether or not they practice safe sex.
Hi. Nice to see you again. The overall goal for the second session is to meet with the client and to explore what forms of birth control that they used in the past. Why did you choose the condom?
Because it was easily accessible.
We explore, the dislikes and likes about the form of birth control that she used in the past and, what difficulties she had with it. Is there anything about the condoms that you dislike?
At times I would just not use them, or depending on the moment, just easily forgotten about.
The goal is for her to talk to the medical provider, to just explore different forms of birth control and to choose a more safe form of birth control that she can use.
Also in section 2, we cover the pharmacology of alcohol and its effects on the body and ultimately on the fetus. Our population has a tendency to minimize the effects of alcohol because it's a legal drug. Motivational interviewing allows the client to become the agent of change. A lot of times they don't buy into the treatment process. Sometimes they might have been mandated into treatment, or they came in unwilling. Motivational interviewing teaches us to roll with resistance and sidestep while you're rolling with the resistance, enjoying the movement with the client.
Allowing them to work through their issues and coming to a conclusion that's suitable for them.
In our section number 3, we discuss what happened in the family planning visits
Caprice, I'd like to take this time to elaborate on some of the things that I heard you say in our last session.
We review which birth control method they chose and how comfortable they feel with that method.
I've been informed of the dangers of drinking while being pregnant, as well as drinking and having unprotected sex.
In Section 4 with Project Choices, we explore with the client whether or not their alcohol consumption decreased, increased, stayed the same, and whether or not they practice safe sex.
Okay. With your knowledge of the Project Choices, what would you do to prevent this from occurring again?
We also discuss future plans and goals for the stages of change.
As a result of these counseling sessions, the clients or participants learn today what they can take with them tomorrow, and that's the most important goal.
Project Choices is an evidence-based initiative. That means it works.
You incorporate what you learn in your life, you know, how to be a good parent, how not to drink and not to have unprotected sex.
The women have showed improved alcohol use scores, including a decrease in binge drinking and an increase in abstinence. And this is along with an increase in effective contraceptive use.
Once you know, you know. You know, you can't say I don't know when you've been given information.
Not only does Project Choices work, but we find that counselors and clients really like this intervention.
I feel hopeful, and I'm doing much better. My daughter's doing better, and I'm just looking forward to bigger and better things.